Sponsored by the Carpal Rx. If you find that you have hand pain or numbness and tingling in your fingers, perhaps some wrist pain, just from doing simple things like typing or trying to button your clothes, then you may have carpal tunnel syndrome. This is a painful condition experienced by millions of people. Some people get relief by using ice or applying heat to their painful hand. But which one is really better? You might say just ask around. Some people say that a heating pad works best to relieve the pain, while other people claim that an ice pack or ice water does the job. But in reality, your hand pain can be treated in one of two ways, depending on your needs. And to understand why, you have to understand carpal tunnel syndrome. Carpal tunnel syndrome is a problem that occurs deep inside the wrist, inside an area known as the carpal tunnel. The flexor tendons, here shown in white, are surrounded by a fluid-filled sheath, shown in blue. Under certain conditions, this fluid-filled sheath tends to swell, and that swelling pushes on the median nerve, here shown in yellow. That compression on the nerve causes it to become irritated, and that's what produces the pain and other symptoms of carpal tunnel syndrome. So whether you need ice or heat to treat your hand pain depends on whether you have stressed your hand lately, as in doing excessive typing, called acute pain, or whether the pain is there most of the time without doing much to your hand, called chronic pain. Therefore, use ice for acute or sudden pain, especially after you've used your hands to do a lot of hand activities. The ice will reduce pain due to inflammation on a short-term basis, but shouldn't be used as a long-term healing therapy. For that, you should use heat. Heat increases blood flow, and blood flow promotes healing for the long term. Frequent application of hot towels or a heating pad will go a long way to promote healing inside the carpal tunnel. You can greatly accelerate healing by using daily deep tissue massage therapy. It's nearly 100% effective in relieving the symptoms of carpal tunnel syndrome, but it's only effective when it's done daily. Visiting a massage therapist once a week is worthless in alleviating your symptoms. You need daily therapy. So how do you get this effective deep tissue massage daily without visiting a therapist daily? The answer is the Carpal Rx. If you have carpal tunnel syndrome, then you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal Rx. If the Carpal Rx doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal Rx was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal Rx automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal Rx will do the rest. Visit the Carpal Rx at carpalrx.com.